China's new health scare is giving the world a sense of déjà vu. The bustling corridors of hospitals filled with the echoes of hurried footsteps and the murmur of concerned voices paint a picture all too familiar. Hospitals are overflowing and patients are filling hallways. The scenes are reminiscent of the early days of the COVID-19 pandemic, where medical facilities were pushed to their limits. But this time, the culprit is not COVID-19. Instead, it's a lesser-known virus that is causing widespread concern and confusion. It's a virus many have never even heard of, HMPV or human metapneumovirus. This pathogen, though not new to the scientific community, is now making headlines as it spreads rapidly. This new threat is a stark reminder that the world remains vulnerable to infectious diseases. Despite advancements in medical science, our defenses can still be breached by emerging pathogens. The speed at which HMPV is spreading has caught many off guard. The virus, which primarily affects the respiratory system, is causing a surge in hospital admissions. Health officials are scrambling to understand this new foe and contain its spread. Researchers are working around the clock to study the virus's behavior, transmission, and potential treatments. The situation in China highlights the fragility of public health. The strain on healthcare systems is a stark reminder of how quickly things can escalate. Even as the world recovers from the COVID-19 pandemic, new threats are emerging. The battle against infectious diseases is far from over, and vigilance is key. The HMPV outbreak underscores the importance of global cooperation and preparedness. International collaboration is essential to tackle such health crises effectively. We must learn from the past and act swiftly to prevent history from repeating itself. By sharing knowledge, resources, and strategies, we can build a more resilient global health system. The scientific community is already mobilizing, with efforts underway to develop vaccines and treatments. The lessons learned from COVID-19 are being applied to accelerate these processes. Public awareness and education are also crucial. Informing communities about preventive measures can help curb the spread of HMPV and other infectious diseases. While the challenge is significant, there is hope. With coordinated efforts and a proactive approach, we can navigate this new health scare and emerge stronger. HMPV stands for human metapneumovirus. This virus has been a subject of extensive research due to its impact on public health. It's a respiratory virus that was first discovered in 2001. Since its discovery, scientists have been working tirelessly to understand its behavior and develop effective treatments. This virus is part of the same family as the viruses that cause measles and mumps. This family of viruses is known for its ability to spread rapidly and cause significant health issues. HMPV primarily attacks the respiratory system, leading to a range of symptoms. These symptoms can vary greatly depending on the individual's health and age. These symptoms can range from mild, cold-like symptoms to severe respiratory distress. In some cases, it can lead to pneumonia or bronchiolitis, especially in vulnerable populations. The virus spreads through respiratory droplets released when an infected person coughs or sneezes. These droplets can travel through the air and infect others who breathe them in. It can also spread through direct contact with contaminated surfaces. This makes it crucial to maintain good hygiene practices such as regular hand washing and disinfecting commonly touched surfaces. While HMPV can infect anyone, young children, the elderly, and individuals with weakened immune systems are particularly vulnerable to severe illness. These groups often require more intensive medical care and monitoring. The virus is found worldwide and is a common cause of respiratory infections, especially during the winter months. Its prevalence during colder seasons highlights the importance of seasonal health precautions and awareness. China's healthcare system is facing immense pressure. The rapid surge in HMPV cases has led to a shortage of hospital beds. Intensive care units are nearing capacity. Medical professionals are working tirelessly to provide care for the influx of patients. The situation is particularly dire in major cities where the virus is spreading rapidly. The Chinese government has implemented strict measures to control the outbreak. Hospitals have set up triage systems to prioritize severe cases. Health officials are urging the public to practice preventive measures, such as wearing masks and frequent hand washing. However, the sheer volume of cases is posing a significant challenge to containment efforts. Several factors contribute to the current HMPV surge in China. One significant factor is the waning immunity to respiratory viruses after years of COVID-19 restrictions. Lockdowns and social distancing measures, while effective in controlling COVID-19, also reduced exposure to other common viruses. This lack of exposure may have led to a decline in population immunity, making people more susceptible to HMPV infection. Additionally, seasonal factors play a role. HMPV, like many respiratory viruses, tends to circulate more widely during the winter months. The colder temperatures and increased indoor gatherings create favorable conditions for viral transmission. The combination of waning immunity and seasonal factors has created a perfect storm for the HMPV outbreak in China. Section 5: HMPV versus COVID-19, a tale of two viruses. In this chapter we delve into the intricacies of these two respiratory viruses that have impacted global health in significant ways. While both HMPV and COVID-19 are respiratory viruses, there are key differences between the two. Understanding these differences is crucial for effective prevention and treatment strategies. HMPV, or human metapneumovirus, is generally considered less contagious than COVID-19. This means it spreads less easily from person to person, making outbreaks more contained. The incubation period for HMPV is shorter, typically 3 to 6 days, compared to COVID-19's incubation period of 2 to 14 days. This shorter incubation period can make it easier to identify and isolate cases more quickly. Symptoms of HMPV are also generally milder than those of COVID-19. Common symptoms include cough, fever, and nasal congestion, which are often mistaken for a common cold or mild flu. However, HMPV can still cause severe illness, especially in vulnerable populations, such as the elderly, infants, and those with weakened immune systems. Hospitalization may be required in severe cases. It is important to note that the severity of both viruses can vary greatly, depending on individual factors such as age, underlying health conditions, and vaccination status. For instance, older adults and those with chronic illnesses are at higher risk for complications. While the world focuses on the HMPV outbreak, it is crucial to remain vigilant about COVID-19 and continue to follow recommended preventive measures. This includes wearing masks, practicing social distancing, and getting vaccinated to protect ourselves and our communities. Ongoing research and public health efforts are essential in combating both HMPV and COVID-19. By staying informed and adhering to guidelines, we can mitigate the impact of these viruses and safeguard public health. Section 6. Stop the spread: how HMPV transmits. HMPV spreads primarily through respiratory droplets. When an infected person coughs or sneezes, tiny droplets containing the virus are released into the air. These droplets can travel up to 6 feet and infect others who inhale them. The virus can also spread through direct contact with contaminated surfaces. For example, if an infected person touches their nose or mouth and then touches a doorknob, the virus can survive on that surface for a period of time. If another person then touches the doorknob and then touches their face, they can become infected. Understanding how HMPV spreads is crucial for implementing effective prevention strategies. Section 7. Protecting yourself: prevention methods and strategies. Preventing the spread of HMPV relies on many of the same measures used for other respiratory viruses. Frequent hand washing with soap and water is crucial. If soap and water are not readily available, hand sanitizer containing at least 60% alcohol can be used. Covering coughs and sneezes with a tissue or elbow helps prevent the spread of droplets. Avoiding close contact with sick individuals is also important. If you are sick, stay home to prevent spreading the virus to others. Wearing a mask, especially in crowded indoor settings, can also help reduce transmission. These simple yet effective measures can significantly reduce the spread of HMPV. Section 8. The research race: seeking treatments and vaccines. Scientists around the world are working diligently to develop treatments and vaccines for HMPV. Currently, there is no specific antiviral medication for HMPV. Treatment focuses on managing symptoms and providing supportive care. Researchers are exploring the potential of existing antiviral drugs that target similar viruses. Developing a vaccine for HMPV has proven challenging due to the virus's complex structure. However, promising research is underway. Scientists are investigating different vaccine approaches, including mRNA vaccines and protein subunit vaccines. While a vaccine for HMPV is not yet available, the ongoing research offers hope for the future. Section 9. A global call to action, vigilance, and preparedness. The HMPV outbreak in China serves as a stark reminder that infectious diseases remain a significant threat to global health. We must remain vigilant and prepared to respond to emerging health threats. This includes strengthening surveillance systems, investing in public health infrastructure, and promoting global cooperation. On an individual level, we must prioritize our health and well-being. Practicing preventive measures, staying informed about potential health risks, and seeking timely medical care are crucial for protecting ourselves and our communities. By working together, we can navigate the challenges posed by infectious diseases and build a healthier future for all.